This is Emil Mikhail. Today I am talking about safety. I am talking about needle stick injuries. Let me define the needle stick injuries. Needle stick injuries are defined as percutaneous injuries with sharp objects contaminated with blood or other body fluid. Let me talking about the risk of infection by needle stick injuries. When children find discarded needle and injure themselves while playing with them, the user is generally unknown, and the parents and healthcare providers fear that the needle may have been discarded by an injection drug users. Needle stick injuries from devices used for blood collection or for injections expose healthcare workers to the risk of serious infection. The important pathogens to be considered in this situation are hepatitis B virus or hepatitis C virus and human immunodeficiency virus. The prevalence of hepatitis or human immunodeficiency virus among patients varies in different regions. In the absence of up-to-date local data, it is possible that the needle may have been contaminated with one or more of these viruses. Now let me talk about the cause of needle stick injuries. May caused by syringe needle, sharp object, materials used during patient care procedures, and trash. A needle stick injury happens when the needle from a syringe used for injection accidentally pierces or punctures the skin. Some children may be exposed to needles and syringe at their home. For example, if a family member injects insulin, and sometimes a child may come across discarded needle. Children should be taught never to touch a needle or a syringe. Many medical procedures in hospital require the use of sharp medical devices, such as hypodermic needles, lancets, and intravenous system. In addition to the sharps used by home health care, healthcare workers are at risk for infection from blood-borne pathogens as a result of percutaneous injuries from sharps. Needle stick injuries may occur when employees dispose of needle, collect and dispose of materials used during patient care procedures, administer injections, draw blood, or handle trash or dirty linen. Where needles or sharp objects have been inappropriately discarded. Now we know some information about the definition and the cause of needle stick injuries. Let me talk about the best way to protect against needle stick injuries. It's very important to follow these: education, children, parents, healthcare providers, use of safety devices, providing safe medical equipment, training how to use safety device, the safe handling and disposal of needles and other sharp instruments. Let me start with education. Needle stick injuries may be prevented by educating children, parents, and healthcare procedures about the dangers of handling used needles and other objects contaminated with blood or other body fluid. The second one, use of safety devices. What is safety sharp medical device? It can defined as a non-needle sharp or a needle device used for withdrawing body fluid, accessing a vein or artery, or administering medication or other fluids with a built-in safety features or mechanism that effectively reduce the risk of an exposure incident. The use of needle stick safety device is an essential means of protecting from needle stick injuries. They should be activated by means of a one-handed technique and allow the worker's hands to remain behind exposed sharp point. Training how to use safety devices. The safe handling and disposal of needle and other sharp instruments, it is very important. The safe handling and disposal of handles and other sharp instruments should form part of an overall strategy of clinical waste disposal to protect staff, patients, and visitors from exposure to blood-borne pathogens. It's important that the used sharp should be disposed immediately after use in the sharp containers. Sharp containers must be located in a safe position away from public access area and in out of the reach of children. Must not be used for any other purpose than the disposal of sharps. Should be temporarily closed when not in use. Must be disposed of when the fill line is reached. Now we have information about the definition, the causes, and how to prevent needle stick injuries. Now I reach to the end of my presentation, the conclusion. We have to know the definition are defined as percutaneous injuries with contaminated sharp object. The risk is serious infection of hepatitis or human immune deficiency. The cause, syringe needle, sharp objects, or trash. Prevention, use the safety devices, training, sharp should be disposed immediately after use in sharp contaminated containers. Thank you for your time.